This segment of CoastLife is sponsored by Beebe Healthcare.
CoastLife, we like to have fun on this show all day, every day, but it is also important to look out for each other in our community, and sometimes that involves talking about very serious topics. I mean, Paige and I have talked about self-image, beauty standards, all kinds of stuff that can really start messing with your head and really do some serious damage. So here to talk to us about we're breaking down eating disorders, sort of the mental health position behind that, and more is Kim Hyatt, a registered dietitian, joining us with Beebe Healthcare. Thank you for coming in and joining us.
Yes, thank you for having me. I love being here with you guys.
We love having you. Like, seriously, even when you're gone, we're like, we should have Kim back. She's so fun.
I love it. And I know this is a pretty heavy topic, but I think it's really important that we draw awareness. This week is the perfect week for this, obviously. But eating disorder approach takes multiple healthcare providers, dietitian just being one of those.
Sure. And I mean, there's a lot of factors that may go into an eating disorder. So I guess maybe let's break down an eating disorder, what it looks like, because it's not really it doesn't have just one look, one diagnosis per se.
Sure. So in our brains, we often think that eating disorders occur in people that are very small in size, very thin, very undernourished. And that is one subset of an eating disorder where somebody overly restricts what it is that they eat. There's actually a whole subset of eating disorders that either take place from over-restricting or what we call binging and purging. So eating a large quantity over a small amount of time, or even just changing your behavior in a hyper-restrictive way where you won't touch certain foods or you'll only touch certain foods. So there's a difference between eating disorders and disordered eating. An eating disorder is a diagnosable condition in which a person has to meet multiple criteria. That criteria is done by a psychiatrist, a psychologist, but disordered eating is the potentially harmful behavior that can develop into an eating disorder. So we don't just wake up and are diagnosed with an eating disorder. This develops over time.
Right.
I'm curious about what could lead to it. I know you're a registered dietitian, so I know it's not so much maybe the psychological aspect, but when you work with people, what are you seeing as some of the oh, maybe this is why it led to this?
Sure. This is a complex thing, and a lot of times when we think about it, we think, okay, there's just a treatment for an eating disorder, or this person needs to seek treatment because there may be a problem. Believe it or not, the things that play into eating disorder development can be neurobiological. So there can be hormone imbalances that are actually passed down genetically. Believe it or not, it can run in families. There are even personality traits. So people that have a chronic negative self-image or have a poor self-worth or struggle with perfectionism tend to lend themselves, to an easier risk of developing an eating disorder because of those certain personality quirks. And then there's also, like you mentioned, there are societal, social media, the standards that we interject on people can lend themselves really well. When we have external forces that are telling us what does it take to be healthy or good or beautiful, this can change our view of self-worth. And one of the cornerstones of an eating disorder, regardless of the type, is the fact that there is a distorted self-image. The person, the way that they view themselves is not actually what is present in real life, but that's the view that they have, and that is what actually shapes their behavior around how they eat.
Very interesting.
Very interesting. And
I didn't know that.
I didn't either. And scary how many factors can go into it that you're not even necessarily aware of. I didn't even know that genetics could play into it.
No
or
idea.
A hormone imbalance. But I mean, there's also some people have such complicated relationships with food. And I feel like that's kind of a term we hear tossed around on social media now. Like, I'm trying to work on a healthy relationship with food. What does that kind of mean? And why would, you not only a registered dietitian, but kind of with Beebe's bariatric branch, be here talking about eating disorders?
Right. Well, those who know me might think, oh, this is a little bit of a, an odd combination here. But, obesity treatment and weight treatment and eating disorders are not that far removed from each other. And when you talk about relationship with food, that is actually what I spend the bulk of my time doing with my patients, is working on how do I view food? Am I willing to accept certain nutrients? Am I using food as fuel, or am I using it or avoiding it for some other underlying emotional reason? So while being a dietitian, I care very much for my patients to work on what is the most healthful for them genetically and for what they need at that time, but are they potentially shying away from things to the point where they might develop nutritional deficiencies? Are they overly restricting in a way just because they're chasing something physical that might harm them in the long run? So as a dietitian, I'm looking at, are you, missing foods that have certain vitamins, certain minerals? Are you afraid to potentially gain weight or lose weight to a point where you now start hyper-controlling your nutrition plan with your mind just to try to control control what the physical appearance does.
Wow. It's a lot to think about.
It's a lot to think about, and we're not done quite yet. Kim's got more to tell you on this topic, and then we're going to dive a little bit deeper too. So stay right there. We're going to get a little bit further into this when CoastLife is back.
This segment of CoastLife is sponsored by Beebe Healthcare.
CoastLife, before the break, we were talking about a bit of a weighted topic, eating disorders, but it's a very important one. And this week, we're spreading a bit of awareness about eating disorders and really how to kind of spot them and what we can kind of do about them. So Kim Hyatt with Beebe Healthcare didn't go anywhere. She is still here talking to us about eating disorders. And we kind of want to reiterate a point, too, that you were saying. I mean, with a registered dietitian's point of view, you're probably seeing all types of patients. It's not really, skinny means this or a certain size means that when it comes to eating disorders. They don't have one way to look.
Right. So the crux of this whole week is to raise awareness in and around eating disorders. So if we can have one takeaway, it's that you cannot look at somebody's physical body and know if health or disorder is present. We need to break those two associations from each other because it is actually playing into the problem of eating disorder development.
That's a good point to make. And if someone is maybe thinking they have a problem, or maybe a loved one, like a parent sees that their young kid might be showing signs, how can you confirm that for them? What signs should they be looking for?
Yeah, that's a great thing. Sometimes there's a very tactful way to go about it, and you can potentially push your loved one away. So it's really important to know that eating disorders often don't occur on their own. They're not always single standing disorders, and they'll often occur in conjunction with other psychological illnesses such as anxiety or depression or sometimes PTSD, which is post-traumatic stress disorder. So I think a primary place to start is getting established with mental health. The earlier we get established, the better the treatment plan can be, and eating disorder treatment can be highly effective if caught early. So if we start to notice that there are changes in behavior in our loved one, different eating patterns, an increase in anxiety or avoidance of certain things, it's time to think about mental health.
Yes, and I know that BB Behavioral Health has a lot of options for if you start seeing those signs of mental health struggles. Where should people go to kind of get started on this journey? Should they see signs of maybe mental health struggles or an eating disorder?
Sure, and just as the case with most health conditions, the earlier you get involved in care, the better your outcomes are going to be. So BB Behavioral Health is not an eating disorder clinic in and of itself, but when you are thinking that you might want to get a hold of your behaviors, whether it's your relationship with food, an untreated anxiety, medical management in terms of, as it relates to psychological illness. So if you're looking to get started, you can contact BB Behavioral Health at 302-645-1099. They have psychiatrists, nurse practitioners, and a whole team of counselors to get you started. And then you could be referred for further treatment if it's required.
Awesome. Well, Kim, thank you. Is there anything else that people should be aware of to maybe kind of start breaking down the conversation, how to even start having that conversation about eating disorders? Because it is still sort of a taboo topic in a lot of circles. So maybe what are some of the beginning steps to start that conversation?
It is a difficult one, and sometimes, it's best just to be the support and allow the person to open up in the ways that they can. That is one thing as a dietitian that I do often with my patients is I talk about their relationship with food and how they view themselves. So when you notice that there is a breakdown in how somebody is viewing themselves versus who they actually are on the outside, you can kind of tell that maybe this is, maybe it's worth talking to somebody about. I'm here to support you, in any realm that you want me to, and I will lay in the background for you if you need me to as well.
Great advice. I think a lot of people could use that advice. Especially if you've never been through it, it can be a tricky way of, you might just want to say like, hey, you're looking a little thin, or anything like that, and you got to tread a little lightly.
Yes, and I think it can be a very long-term struggle as well. It's not even with treatment, you can still have a very complicated relationship either with food or with that self-image. So it's very ongoing, long-term treatment.
Yeah, and I will say, you're right when you say it's a complicated thing to do. We very often, whether somebody's weight is an overweight person or an underweight person or a normal weight person, we feel that it is okay to comment on such. So it's one of those, psychologically loaded health conditions, which takes a little bit of tact and a little bit of grace.
Kim, thanks again for coming in and telling us, just about the awareness of eating disorders and maybe some of the beginning steps should you or somebody that you love be struggling right now, because there are a lot of options and there are people there to help you.
Yes.
Thank you for having me very much. This is a very important topic.
It is a very important topic. Kim, thank you again. But we do have some more CoastLife to get to. If you are in a charitable mood, we've got some ways that you can give back to the community coming up next.